COVID-19 pandemic has caused a lot of confusion, economic hardship, political disharmony worldwide to the extent of pulling WHO itself into controversy. It has even put science in doubt. It behooves all of us to approach this objectively and realistically. In today's tutorial, we will try to gain an objective view of COVID-19 on the basis of principles of medicine that we talked of in the last tutorial. As we have already emphasized, the three pillars of principles of medicine are: 1. To know what is normal. 2. Then to know what is abnormal, and 3. Finally how to manage that abnormality. In normal, we need to know: 1. What a virus is. 2. How virus causes infection. 3. What SARS-CoV-2 virus is. Virus is a transition state between chemistry and biology, non-life, and life. When a molecule acquires the ability to form the protein it needs to survive and to replicate itself to propagate its species, we call it life. Outside of the cell, virus can do neither. Therefore it is but a particle, but once it enters a cell it can do both. In the world only nucleic acid can form the proteins it needs and therefore is called the molecule of life. Nucleic acid can be DNA or RNA. Thus virus can be DNA or RNA. DNA viruses are usually double-stranded but can be single-stranded, whereas RNA viruses are usually single-stranded but can be double-stranded. The nucleic acid is intermingles with protein called the nucleocapsid. Some of the virus have a lipid envelope and are called enveloped virus, whereas others do not and are known as naked virus. They are of various shapes and size ranging from 5 to 300 nanometers. In comparison, size of bacteria is 500 to 5000. And that of a human cell is 0.10,000 to 100,000 nanometers. Thus viruses are too small to be seen by optical microscopes and can only be detected by electron microscope. Virus can infect any type of cell and they display species tropism in that some can infect bacteria known as bacteriophage, others can infect plant, animal, or human. Their life cycle basically is: attach to the cell membrane, penetrate and enter the cell. Inside the cell, they synthesize their own protein and replicate, multiply into thousands. They then lyse the cell, releasing virus particles ready to infect other cells. They enter the human body via skin, respiratory tract, gastrointestinal tract, urogenital tract, through vectors directly blood. They not only have species tropism but also tissue tropism, as papillomavirus infects the skin, rabies virus infect the nervous system, rotavirus infect the gastrointestinal tract, influenza virus infect the respiratory tract, mumps virus infect the parotid gland.
SARS-CoV-2 is a positive strand RNA virus which is enveloped by a lipid membrane. It forms 13 proteins, of which 4, namely membranous enveloped nucleocapsid, spike, are structural and rest are functional proteins. Spike proteins give it the appearance of a crown, thus it is named corona. It has affinity of the ACE receptors of type 2 pneumocytes in the alveoli of the lungs via the spike proteins.
When we talk about abnormality, we need to know: infection from SARS-CoV-2 depends on 3 factors. 1. Infective dose. 2. Viral load. 3. Duration of exposure. Its spike protein acts as a ligand and attaching itself to the ACE2 receptor, which are particularly abundant in the type 2 alveolar cells which secrete surfactant. There it replicates and then rupture the cell to come to the alveolus, from where it is expired to the environment while speaking, sneezing or coughing, ready to infect another. The body tries to rid the virus by 2 mechanisms: nonspecific or innate, specific or acquired. Nonspecific response can either underdo or overdo and cause cytokine storm, a major cause of mortality in COVID-19 infection. After a week or so, specific immunity sets in. IgM then IgG antibodies are produced to kill the virus, and patient then becomes serologic positive and recovers from the illness. The quantity and quality of response depends upon age, as elderly are more vulnerable to COVID-19. Sex, as male are more vulnerable to COVID-19. and comorbid state of the host as diabetic are more vulnerable. The interaction between the virus and response of the host result in the following periods of clinical course of the disease. Incubation period is the period between acquiring the infection to display of clinical signs and include two other periods. One latent period is the period from acquiring to the infection to spreading the infection. Two danger period is the period from being able to spread the infection to onset of clinical signs. Clinical period is period from the onset of clinical signs to resolution or death. Infective period is the danger period plus the clinical period combined. Danger period is called danger period because at this time asymptomatic persons can spread the virus. 80% of infected have none to mild symptoms and is treated at home. 20% will need hospital admission, of which half will need intensive care, that is 10%. Of these, half management of a patient entails 1. Making a diagnosis. 2. Treating the patient. Diagnosis includes aim of diagnosis and modality of diagnosis. Treatment includes aim of treatment and modality of treatment. As discussed in the last tutorial, the aim of diagnosis is threefold. 1. To find out the condition, which is COVID-19. 2. To find the cause of the condition. COVID-19 is caused by SARS-CoV-2 virus. 3. To find the complications of COVID-19, which are acute respiratory distress syndrome, multiple organ dysfunction syndrome. The three pillars of modality of diagnosis are 1. Detailed history. 2. Thorough examination and 3. Relevant investigations. Any patient present in three ways. 1. Asymptomatic. 2. Symptomatic. Symptoms due to the virus are loss of smell, loss of taste, dry cough, dyspnea. Symptoms due to response of the body are fever from secretion of interleukin-1, body ache and malaise due to secretion of various cytokines. Complication as mentioned are ARDS and MODS. As far as relevant investigations are concerned, COVID-19 is diagnosed by either finding the RNA of the virus, finding the specific protein that it makes, or detecting the antibodies that the body mounts to counter the virus. The immunological tests are RDT or rapid diagnostic tests and are of two types, namely 1. Antigen detection test, in which the virus protein are detected. This test is specific but the sensitivity is low. 2. Antibody detection test, in which the antibodies mounted by the host against virus are detected. Detection of IgM implies recent infection and detection of IgG implies past infection. How long the antibodies confer immunity is still not clear. Molecular tests are more specific and detects the nucleic acid of the virus and can be done in several ways. The standard is PCR, which stand for polymerase chain reaction, in which the nucleic acid is amplified and then detected. CRISPR, which stand for clusters of regularly interspersed short palindromic repeats, is a recently developed gene editing technique which holds huge potential both for diagnosis and treatment. Once we have made a diagnosis, we go for treatment. Aim of treatment are fivefold, namely 1. Promotive. 2. Preventive. 3. Curative. 4. Palliative. 5. Rehabilitative. Promotive treatment implies to further improve your health. It too has three arms, namely 1. Stress reduction. Stress is our response to an adverse event. Numerous studies have shown that meditation in the ancient tradition of yoga helps to relieve stress. 2. Physical exercise. We favor yoga chi as form of exercise as it can be done anywhere, anytime by anybody. 3. Chemical. No smoking. Moderate alcohol intake. Intake of immune-enhancing food. Preventive treatment implies avoiding a specific disease. There are three principles to avoid COVID-19. 1. Zero exposure. 2. Minimal exposure. 3. Exposure. The following 5 measures are taken to avoid coming in contact with those infected. 1. Quarantine means housing those likely to be infected separately. 2. Tracing means housing separately those that have come in contact with infected cases. 3. Isolation means housing infected persons separately. 4. Close down means shutting down institutions. 5. Lockdown means not allowing people out from their residences. 1 is infected with SARS-CoV-2 virus by 2 ways. 1. Breathing air in which there is virus. 2. Touching one's eyes, nose, or face with one's hand which could be contaminated with the virus. Therefore, to avoid catching infection by air, avoid closed spaces. Maintain physical distance, not social distance. Wear a mask. If both infected and susceptible do not wear mask, risk of infection is very high. If infected does not wear a mask and susceptible wears a mask, risk of infection is high. If the infected wears a mask and susceptible does not wear one, risk of infection is medium. If both wear a mask, risk of infection is low. To avoid catching infection by hand, dispose properly things that can be disposed. Disinfect things that cannot be disposed. Avoid touching your face with your hand. Sanitize your hand after touching anything in public. Before touching your face, wash your hands with soap. The holy grail of prevention would be an effective vaccine. There is plethora of potential vaccines in trial phase, though till date none have come to the market. One caveat is that COVID-19 is the 7th generation of coronavirus to infect humans. It is almost certain that viruses will mutate and another generation will afflict us. So it is imperative that we embrace our traditional habits. Greeting by Namaste. Avoiding hugging unknown people. Washing our hand before eating. Taking off skos and cleansing oneself before entering home. To date there is no total cure for the disease, but there is rush to find cure, and the 2 basic strategies are: 1. Targeting the cause or the virus. 2. Targeting the response or adverse reaction generated by the host. Strategies to target the cause are: blocking the ligand as with antibodies or convalescent serum. Blocking the receptors. Blocking the formation of its proteins. Blocking its process of replication. Blocking the packaging of nucleic acid and protein to form a virion. Secondly, strategies to target the response are: immune booster, antioxidants, immune suppressant, gene editing by CRISPR technology, mesenchymal stem cells to avoid fibrosis of lung parenchyma. Palliative treatment would mean symptomatic treatment as antipyretic for fever, cough suppressants for cough, oxygen for dyspnea, respiratory support for ARDS or acute respiratory distress syndrome, organ support for MODS or multiple organ dysfunction syndrome. Rehabilitative treatment is called for if the organ or system does not fully recover from the injury. Pranayam would be beneficial as a rehabilitative respiratory therapy. To sum up, COVID-19 has once again proved that prevention is better than cure. It has vindicated our cultural values and traditional habits. We have a long way to go to unravel the mysteries of nature. Practice Yoga Chi to promote your health. As always, Buddha Maya is with you in your quest for health.
Hope this overview of COVID-19 has given you a realistic view of the pandemic. Do like, share, subscribe, and comment on the tutorials. Bye bye for now, and see you next week.